Hi, my name is Melina Jeanlouis, and I am the Executive Vice President at the National Alliance for the Advancement of Haitian Professionals. We are excited to bring to you the one on one membership conversations. These conversations are our members' opportunity to showcase their hard work and dedication within the community. We curated these one on one virtual dialogues as part of our mission to educate, connect, and empower. Our efforts towards recruiting and retaining more members in 2022 would not be possible if not for our current members' loyalty and dedication to us as an organization. From all of us at NAAHP, thank you.
Hi, good evening, everyone. Today's our second virtual membership spotlight. Like we've just mentioned, we're trying to do that to get everybody to know about what we have for members. So today we have Mr. Renaud Lewis. Today who's going to be speaking to us about what he is in the community and what he does in the community. And before we get started, I would like to present myself, who I am. I am the manager of member services, and currently I live in Rhode Island. And what I do right now is I am work full time as a consultant for a coastline employee assistance program, and also I have a private practice where I do consult like individual, family, and also I'm also involved with the Haitian community also here in Rhode Island. It's called the organization is called HAPARI, which is Haitian American Partnership for Positive Action in Rhode Island. So and I got involved also with NAAHP, and now I'm the manager of member services. So I just want to introduce us, Mr. Renaud Lewis, who's going to be our guest for this evening. And so, Mr. Renaud, would you like to tell us a little bit about yourself so we can get to know you a little bit before we start asking you some questions?
First of all, let me say thank you very much for allowing me to be part of the panel. And it's a pleasure, it's an honor. And then I think that what you guys are doing an outstanding job in that community. Briefly, I know that if I have to talk about me, I will take the entire day to talk about me. But let me say that I'm currently working at Jackson Memorial Hospital as a palliative interdisciplinary care nurse practitioner, and I'm also running a clinic in Hollywood, Florida, called Remote Medical Clinic, where basically we see primary and mental health patients. So our main goal is to make sure we focus on prevention, because we spend so much money on treating patients and we spend like so little on prevention. And I do believe that by focus more on prevention, it will allow us to not only eliminate costs, but give patients a better quality of life to make them feel better. For instance, we have somebody that have hypertension. They don't know that they have hypertension. And then we wait until that patient go to end-stage renal disease, heart failure, or high cholesterol before that we can go ahead and prevent that. If we take that prior, we take action to prevent that, it will help that patient. So that's our main goal in the medical clinic. That's the reason why we come in that clinic for that community, so we can educate them by taking the healthcare very seriously ahead of time, so we don't go to all of this thing.
Thank you so much for introducing yourself. So we're going to be asking you a series of questions so we can get to know you better. And feel free to add any other comments or questions as we go through things that might be helpful to us as we get to know you. Okay.
That's
all right. So the first question that we have for you. So what led you to become a member of NAAHP? That's our first question. What led you to us?
That's a beautiful question. I'm part of so many professional organizations. However, when I decided to change gear from business background to medical, and my main focus was to how can I focus and help those people that need the most. I need to make sure that I find an organization or association that have almost the same, how can I say that, the same like background or the same vision that I have. For instance, like, educating, enhance awareness. Those are the key. And in addition to this, NAAHP focus on education, which is like a key for me. Whenever like we talk about education, which I always tell my colleague, you can achieve anything that you want by just going to school and learn something in life. It may be for 1 week, 2 weeks. And this is one of the factors that I see now is pushing, giving scholarship to those that need it, help people like to move forward in life. And I say to myself, you know what, I want to get involved more. And I think that, you know, I'm new, but there's a lot that I think I'm going to bring to the organization, to the association, to make sure we move forward.
Okay. So how did you hear about us? Did you hear it from another colleagues? How did you hear about us then?
I was doing my research. And review some of the association. And I think among all of these things, NAAHP was the first one that stand out to me. And I say to myself, you know what, I need to be part of the association. And like I say, even though that I'm a baby, and I'm giving myself to make sure that, you know what, that association will move forward and help that community that we're living in, educate them about what they need so they can have a quality of life that they deserve.
Okay, perfect. And so I think that you might have answered that question, but I'm going to ask anyway. Maybe you might want to add to that. Is your professional and personal life impacted by becoming a member? If so, in which way?
I would say in a good way, because it allowed me to focus more on what that I want to accomplish. It allowed me to be statement for NAAHP and the core value. And I see there's a lot of things that I can contribute to it. So it changed me the way that I used to see things when dealing with patient care. And I see, you know what, I need to move forward by involving more. So in a good way, NAAHP has really made a big impact on me.
Okay. And so would you say that also impacted your personal life as well?
Personal life in the way that, you know what, if you give back, you will get back. So once you go, that's the reason why I'm urging people, please, there's a little link on that website. Click on it, donate. Because once you donate, you're helping those that don't have access to go to school, that don't have access to learn something. Donate because it will help. And the way that I say, you know what, I need to help a friend, I need to help another family member. And that's the reason why that I say not only that it affects me professionally, but personally, because it showed me that, you know what, by giving back to people and not expecting anything back, you will get way more than what you expected.
That's true. That's true. So well said. All right. So you choose many career paths. So next questions for you. What was the drive behind choosing those career paths? And which one are ones that are the most satisfying to you? And are those your dream jobs, your passion? I know there's a few like brackets to those questions, but it's a heavy load question, but I'm hoping you can do your best in helping us to understand that question.
I'm gonna try my best to answer all of them, you know.
Yeah.
First of all, you said, like, you know what, why I decided to choose that career path.
Yeah. Yeah.
What was behind it, what was the drive behind this thing? First of all, let me say that, you know what, before that I came to healthcare, and I used to be like in public sector. I used for City of Hollywood in Florida for like about 15 years. And I used to also volunteer for the American Red Cross, where I used to be like a shelter manager, and I used to be a disaster action team. Usually I would go volunteer my time with American Red Cross. When we would have hurricane in Miami, we would go out and help. I was a shelter manager. And then I see the nurses, the doctors that come to help. They're not getting paid for those things. They give it themselves to help those people. And I'm watching them from the distance. I say to myself, I need to excel my knowledge and give that community more. And I think there's something missing. You see what happened with the pandemic. The problem that we have with nurses, providers. I say I need to go back to school. Let me go back and involve in healthcare. So that's the reason why that, you know, I decided to go back and become a nurse. And then, you know what, eventually become like a nurse practitioner so I can help my patient to a higher caliber. And then the second question is like, you know what,
which one are the most satisfying to you? Which one you feel most satisfied doing?
Exactly. There's a bunch of them. One, caring for patient, that's a big thing. Educating them. And at the same time, as I said earlier, I work as a palliative care provider. One of the things that what we focus on, people usually when they hear like palliative, they think like, oh my God, I'm dying. It's not that. It's a way to educate those people. It's a way to let them know that, what, I understand that you may have a terminal condition. I understand that you have an anxious condition. But let's talk about an alternative treatment. Let's talk about all the things that we can do. That way that you can feel better. And once you do that, you're not doing it only for the patient, but you also do it for the family. How many times that we have a family member in a hospital setting, they have a disease, and then you know what? The doctor is not giving you or not telling you what the plan of care, or they will come and give you some scientific word, very difficult one. You don't even know what it is. And what I usually most of the to them, you tell them, what, okay, what, we're gonna do, like, what, colonoscopy, we're gonna do this. They don't even know the term behind that word, but they say, okay, no problem. But if you explain it to them, what it is, what we're gonna do for them, it make a big change in their life. So that's the reason why I advocate for those people, educate them, talk to them, caring for those people. This is the most rewarding factor for me, though.
That's good. It sounds like it's very satisfying to the way you describe it. Was that ever your dream job though? Because it sounds like you didn't even start there. It sounds like you got called to do some work and you don't really look what was going around you. Also, I need to do this. But the way when you were talking about your dream job, was that ever your dream job? What would you say, or your passion?
I think, like I was saying earlier, the moment that I left the city, my dream job was to be like, what, a nurse practitioner where I'm gonna help those patients that needed the most when they needed the most. Because what, now, not only that, I'm helping not only my friend, my family, if they has any issue, they will call me. And most of the time, I will go to the hospital or I will come to the clinic. I will provide them my personal number and I will tell them, if you have any issue, any problem, please feel free to call me and I will help you. It's because you have a passion to what you're doing. And if you don't have a passion to what you're doing, you're not gonna stay. Healthcare isn't that easy because you have somebody that's sick, that's looking for help. And then you know what? They're gonna rely on you. Those people's life is in your hand. If you don't have the passion, if you don't have that to taking care of those people, you're not gonna stay for too long. I've been doing it for 7 years, and I think I love it more enough. I have another like 20 years to go.
And you know what? I was just when you said the passion for that, I was thinking about the same thing when you described it. I'm like, it sounds like you have very compassion for people. You're empathetic to their needs. You try to understand where they're coming from, and also to try to give them, like you mentioned, education before. Because sometimes when people don't know, you get anxious, fear about the future or what the diagnosis is. But when you explain to people, they know what to expect. So there's less fear, anxiety about it. It sounds like you try to do that. And when I was listening to you talking, and I hear so much. That was in that passion in your voice and so much compassion toward your patient. So it's literally by answering the question and the way you answer it, you answer the question. That's awesome.
Thank you for letting me know.
What'd you say?
Thank you for letting me know.
Oh, you're welcome. All right. So the next question that we have you reached the level of career path that you were going for? And where do you see yourself in 5 to 10 years?
You know what? As a professional, I don't think we will always say that we will reach where we want to go because we always want to do more. We will always have the extra mile that we have to go. It's the same way that you go to school, you say, oh, I'm going to have a bachelor's degree and then I start. And then after that, you say, oh, I need to go for my master's. It's the same for any profession that you go to. So to answer your question, no, I haven't reached that yet because there's a lot of things that I want to do. The clinic that I have is just like one step to the ladder. However, my long-term goal, or the second part of that question is, where do I see myself 5 to 10 years?
Mm-hmm.
As I was saying earlier, we spend a lot of money in treating patients, but we spend like $0 in prevention. I want to make sure that I make it aware to our elected official, to our community, to let them know we need to spend time on prevention. We need to allocate money for prevention, because you know what? It will save that patient life. It will help us spend so much unnecessary money, because we don't take time to educate somebody that have like a simple disease like for hypertension. Let's say, for instance, I've been working for one of the major hospitals for 7 years. I see a lot of patients come to the hospital. They have a hypertension. By the time they come in, it's already too late for them. That's the time what you do a lab for them, and you see the kidney is already gone. They need dialysis ASAP. We're talking about hypertension. Usually, I call it the silent killer. People may live for years with hypertension, and then we don't know. Specifically, we Black people, we are high risk for hypertension, because it's the way we eat. We don't really do too much activity, and we're not controlling what we're putting in our mouth. And then you know what? We say nothing is okay. The food that we're eating in our belly, those are processed food. There's a lot of salt to conserve those food. And then you know what? We're eating those food, and then you know what? We don't do exercise. Those food remain inside. And then guess what's gonna happen? You start having high blood pressure, and you don't know. And next thing that you know, oh my God, I can't pee. My back is hurting me. Let's just do a complete CBC and realize your kidney, like, you know what, is severely damaged. Why? Because you know what, we take medication that can help you prevent that. Oh, that patient has a student heart attack. Why? Because you know what, that patient has uncontrolled hypertension. They never knew. But sometimes I don't blame them. It's the fact that we don't have leaders that can focus and say, you know what, guess what? We need to change the way we do things now. We need to focus more on prevention. Nowadays, we have a bunch of pharmacy. They give medication for free. All they need is a provider that can give them like a prescription to go get those medication and monitor them like every 3 to 6 months. We can't do that. That's the reason why in the medical clinic, what we do, regardless or not that you have insurance or not, we will see those patients. The only thing, we'll just go ahead and pay to do the lab, then we will review the lab for them. Those medications, we'll make sure we give them the script to go where they get those medication for free, that don't get anything out of their pocket. And if they can come for the lab, we will send the lab to the house to do the lab, and then they fax it or email it to us, and then we will call them, let them know, you know, guess what? We just do a hemoglobin A1C. You are high risk for diabetic. What can we do? Somebody that have diabetic, you don't know that you have at risk for diabetic. What's going to happen? You're going to end up losing a limb. You're going to end up losing vision. What if we just go ahead and take medication for it to go to that level? It will help that patient. So my goal in the next 5 years is to make sure that, you know what, we make a big accent to prevention instead of spending so much money on treating patients.
Awesome. You know what? That's such a great. It was good listening to you talk about this, because as I'm listening to you and I'm like, okay, you say you want to do prevention, and you talk about the legislature as well. Are you saying that? What would your main idea you might want to say that might be able to help people, to educate people and make that those prevention things happen? What would you say that might be a great idea to be able to challenge that, you know, to make sure that that gets done?
What we're doing right now, that's a perfect example of what we're doing right now. Educate them. That's exactly what we're doing here. We just educate them. We let them know. One more thing that we can do, which I've been doing, I go to this radio and talk. Use social media. I use my social media to let people know about prevention. Use those platforms to educate those people. They're free. use YouTube, use Instagram, use Facebook. Put that out there. You will make a difference to somebody. You may not be able to target everybody, but by saving 5 people, only 5 people, you're saving about like 5 family.
Yeah.
5 family. One of the person you have may be the bread maker for the house. Because when that person lay down on the hospital bed, he can't walk, that family become handicapped.
Yeah.
So if you can help that person, one person, you help one family. And in addition to this, in my Haitian community, we also has a very bad stigma when we talk about mental health. They don't want to hear it. When you say mental health, they say not mental health. It's for crazy people. But the thing
Yeah.
mental health is real. You know, people dealing with anxiety, depression, and people think that you're strong enough. Oh, I'm not gonna have that. Anybody, whoever we can be, we will have to deal with it in our lives sometime. Sometimes some of us deal with it perfectly fine, but some of us can't. So that's the reason why that, I want to make sure that, I educate my Haitian community most likely to let them know it's real. There's nothing to be afraid of. There's nothing to be ashamed of. Because treat those. This is going to be my job for the next 5 to 10 years to educate those people, not only about prevention, but about mental health issue that's killing our community.
That's correct. And also when you mentioned that even if you save one family, and also in our community, the Haitian community especially, there's also something called word of mouth. If you do from one person, and then like, oh, I had diabetes, and Dr. So and so treat me, and this and that, before you know it, I was fine. And sometimes word of mouth is also a good way to prevent things. Before you know it, like the whole community will know what you did for one person because you saved their lives and their family. And that's probably another way also to spread the news is just like word of mouth too, by doing 1 or 2 or 3 for 4 people who can reach out to. Before you know it, will spread across. And I think that's a really beautiful the way you start to want to do it, educate, and also trying social media platform, the radio as well, because a lot of Haitian community they listen to the radio, they listen to what's going on the radio, so they might be able to hear how to do it and be able to pass it on. But you're right, it's a very uphill battle trying to change the way they think about mental health. And but like you say, you got to start somewhere and maybe step towards that goal. And so, awesome. All right. So the next question I have for you is, you also engage in many volunteer works. How have you been impacted by these works? And if so, have they impacted your professional or personal life? And what led you to those volunteer work as well?
Yeah, as you can see, one of the things that we focus on in Limat Medical Clinic, because once we first opened in November, and I sit with my partner and I told her that one of the things that we need to be focused on is to make sure we do a series of volunteer work to our community. And one way we're gonna do that is to do a health fair throughout the entire community. So that's the reason why once we have our first opening on Friday, the next day we have a huge fair, which we do a stroke prevention, cardiovascular disease, high cholesterol, diabetic, all of these things. And then after 2 months, we went to City of North Miami Beach with another association. We do a huge health fair again. We were there to assist those people. Next month, we're gonna have another big health fair in City of Hollywood, which is just inviting us last week. So sincerely, I really like what I'm doing. And as I said earlier, it helped me and see life in a different perspective. Some people don't have the need, they don't have the information. I'm trying my best to deliver and let them know the information that they need and give it to them. So I think that, taking time with my personal life to use it to my professional adventure make a really big difference for me.
Yeah. And so I know that when you first started, you had some volunteer work. You kind of it started. We talk about that volunteer work with the Red Cross and all that stuff. So when you came in from Haiti, started school and everything, and then you kind of get led to this volunteer work, which kind of led you to what you are now. So what led you to those volunteer work to begin with? What was your connection with those kind of work?
But let me tell you, I was raised by a single mother in Haiti. So I see the struggle that my mother go through to raise 7 kids. And I was the baby of the family. And we survived because, you know what, my mom has a very good heart. And she always say that, you know what, help one another. Try anything you can to help them. And there's no big reward to see you doing something for somebody and you not expecting anything back from the community, from that person. It's the same way that, you know what, when I came in, I say, not, I need to find a way to get involved. I need to find a way to give back. Because my mom, jobless, raising 5, 7 kids, God showed her the way to do it. But at the same token, if I can give something back to the community, that's one way that I can give back. Volunteer my time to those people that need it. And I feel so great when I'm volunteering with the American Red Cross to see 2, 3 o'clock in the morning. They will call me in my house and then I have to drive for 1 hour to help someone. I'm going to give you a brief story. And I remember that they want me to go help those people. So I have to drive 1 hour. When I get there, one of the family members say, they may pay you really good money to come here. I say, you want to come in? She said, of course. I say, I can't hire you. But one thing that I can tell you, you don't get paid. It's your good heart. And guess what? Once you do that for somebody, you may not have the money back, but the blessing that you have in return, it's a lot. Because sometimes you may have a lot of money, but if you don't have the blessing from God, you may not even be able to use and enjoy that money. So I feel blessed. Whenever that I have an issue, whenever that I have a problem, God always opened another door for me. So personally, He helped me. Professionally, He helped me see things differently in life. What can I do from a professional standpoint of view to help those people? That's the reason why we have Remote Medical Clinic, to help those people that can or cannot afford, a physician, that cannot go to the doctor, to help them. So that's the thing came from simply from my mother. That's it. Always help one another.
Yeah, that's awesome. It sounds like your mom was an incredible woman trying to teach her children how to be a service of others. And out of that, it sounds like you keep saying, the more you render service to others, the more you're gonna get blessed, and the more you're gonna want to, and you feel good about yourself, because you mentioned that you could do a job and then not feel good about yourself, but the kind of service that you give into others, you feel good at the end of the day that you serve someone. That's the blessing, like you mentioned, that comes out of it. You might not get paid for it, but knowing that someone's able to sleep tonight, someone's feeling better physically or emotionally and mentally, so you know for a fact you did something good for someone, and there's a reward just in that, knowing you did something good for someone. And I think that your mom was an incredible woman, teaching you that from young to now, and that stays with you, because now you're able to talk about it and live your life according to what your mom taught you.
And I will pass it to my kids, of course.
Yes. And so what led you from Haiti to United States? What kind of got you to come here?
When I finished, and I think that was way back then, when I finished my high school, and then I went to university at the capital, and then my plan was to study economic science. And then, you know what? I'm the type of person, I anticipate what's gonna happen. I don't wait for the last minute. I'm always thinking about, what will be the next step? And I say, what is there a future here from what that I can do, the vision that I have? Can I accomplish it here? Then I remember that I went to talk to one of my sisters. She's a nun. Actually, right now she's in Africa. She told me, why do you want to go to the United States? I said, I think there's I have a mission. I have a goal. And I don't think that, you know what, I will be able like to achieve that here. Let me come here, get the education that I need, and then you know I can help those people back here. Yes, I haven't been able like to do that because of all the instability that they have in that country. But my goal this year is to see that, you know, when that country stabilizes a little bit, to see what I can do to help those in Haiti. And I think that, you know what, that's the reason why that I have to tell you guys again, thank you very much for everything that you're doing for the community. And then, you know what you're doing, don't go unnoticed. And that's one of the reasons that I become part of the association, because you know what I see that you're doing, the goal, the mission that you have, which align with mine. That's one of the reasons why that, you know what I see that I'm gonna be part of the team. And to answer your question, is to have like a better education so I can use it to my country tomorrow.
Good, very good. So, our next question for you: you wrote 3 articles. What inspired you to write those different topics? There's like 3 different topics specifically, so you can touch base on each one, and you can tell us why inspired you to write those articles.
I usually talk with my colleague, and I usually talk to them about the 3 R's. People say, "What do you mean 3 R's?" And let me explain what the 3 R's stand for. That responsibility, respect, and result. Which means, if I'm as a human being, I take my responsibility to respect one another, to respect my colleague. I will, or the organization will have the result that we're looking for. When I say result, it may be like high productivity, it may be like very good teamwork, it may be like, you know, very good ethical behavior that you want in the organization. Because what happens once you have a company, the more of those employees are very low. Most of the time they stress, most of the time they're depressed, the job cannot be done. They have to refer them to you for EAP to help them and assist them. Because you know
That's
what?
right.
That's one way that, you know what, you can bring those people back. So one of the organizations that I was working with, I see lacking all those factors: trust, respect, and the ethical behavior that I was seeing, and that was overboard employee to upper management, which I tell them that, you know what, I need to just go ahead and focus on something that can make a change. So I wrote those articles and published them one by one, to the point that they called me. They said, you know what, I read your article. Why did you write the article? And I explained them. And they asked me, why do you think we can do? I said, educate those people. Bring a third party to just go ahead and do some type of training for those employees. They listen to me. By listening to me, it really make a big difference in the behavior of those people. Because you know what? If they have to wait another like 2-3 months, the more of that organization may be so low, they may lose a bunch of them. So that was the main reason why I decided to write those 3 articles.
And so, what are the names of the article? Which one was first with the name?
The first one that I wrote was like the importance of ethical behavior in public sector. And then the second one is how trust can affect teamwork. And then the third one is the importance of respect. And
So, tell us the first one. The first one about the public sector. Tell us a little bit about that one. What led you to write this one?
There was one time one of the commissioners of one of the organizations that I was working with seemed to have a problem with one of his colleagues that was on the news. And then he just take his car key and killed one of his colleagues. And then I said, why would a public elected official would do something like that? Is that ethical for you to just wait and take your key and kill your colleague car? So which end up going to jail and so forth. And I said, you know what? This is one of the things that, you know what, I have to just go ahead and talk about, like, you know what, the importance of ethical behavior. That's the time that I was doing my master's in public administration in Nova. And then, you know what, I said, you know what, I need to focus on this thing and talk about, like, you know what can lead if we're not following proper guideline, will not be in civil, what will happen to an organization?
Awesome. So that I can see, because I was wondering like how did this one fit with the other two, and so I just kind of really want to pick up your brain a little bit about why that article was written. And also some of the other two was about team work within an organization. Is that correct?
Yeah, trust affects teamwork in organization. Again, it's the same thing for even in any marriage. Once you lose that trust, you may never get that trust back. So you don't want to break that. So that's the reason why I always tell, like, anybody, even my friend, colleague that I work with, trust is a very important factor. Once you lose that trust from somebody, let's say that you have a manager or a director that you're working with, you don't trust that person. I don't think you want to trust that person back, because he must be doing something really bad to you. So I can't trust that person. It will affect you in your productivity. It will affect you from knowing what you're supposed to do. So again, those were issues that I was seeing happen in the organization that I was working with. I said, we need to target that. We need to just go ahead and focus on this thing and see what can we do to bring trust back to the organization, which they work on it, and then they did a really good job by bringing, explain them how people like to know that they're there for them. So I was very happy to bring that.
Good. I was going to ask you that question. You answered for me, like whether or not your article helped in the organization. And what about now? Like, would you say that has anyone consulted with you on your article about how to make their place of employment better based on your article? Has anyone consulted with you at all?
Not yet. But,
it's more for the future.
But I'm open to it.
All right. I was thinking about that. I'm like, it sounds like you wrote those articles, you know what I mean? And you have some great attention. People use it for at the time when they need to be used. And I'm like, okay, those are just hanging there. And then you kind of shifted a little bit and went somewhere else. And I'm like, okay, so is there any opportunity for, the talent that you have what you wrote in the article to be able to be used at different organizations, because like you said before, if there's no trust, no matter what partnership with anyone, it's not going to work. And I think a lot of organizations can use what you just said, what you talked about in your articles.
Yeah, I would make sure that I forward them to you personal email. At least you can have an idea about them.
Yes, that would be really nice. Yes. Thank you so much for that. All right. So the next question for you: how are you able to have a balance between your professional and personal life? If so, how do you maintain it? If not, what are the barriers to doing so?
This is a very good question. And as you can see, I talk a lot about anticipate, proactive. I'm the type of person that have very good time management. Not only that I have very good time management, I prioritize everything that I'm going to be doing. So by putting those two things together, very good time management, prioritize that, it allow me to balance my professional career in my personal life. That's the reason why I tell people, if you don't know how to manage your time, you have 24 hours. You will always see you going crazy. You need to know how to manage your time effectively and prioritize what do you think need to be done. If that thing can wait for tomorrow, just go ahead and do that. And I try also my best to establish boundary between my work and my family. Those
Mm-hmm.
are the key factors that can really help me when it comes to balance my professional behavior in my personal life.
Yes, I was going to say that because I'm like, if you're the mental health professional too, and you're trying to tell people how mental health really matters and how you can actually get sick for not having a good mental health. And I'm like, okay, you're doing so much, you know what I mean? And I'm hearing you talking, I'm like, oh my goodness, you're doing so much for the community. And I'm like, how do you manage to do all that within 24 hours and still manage to have time for your family, time for your friends? But it sounds like you're saying the key part is setting boundaries and also time management, and also structure, I'm assuming, that keeps you from, have you ever felt like you kind of really, maybe some days were harder than others to maintain that structure or not?
That's the reason why that I use my prioritization. If I can do that today, that can be waiting for tomorrow. So you need to choose the most important thing that need to be done today and work on this thing. That those that can be wait can wait for tomorrow. And then when you come tomorrow, you can say, you know what? Oh, let me target what I didn't finish from yesterday.
Got you. So you kind of like a to-do list of things that this is what needs to be done. I have 5 hours that can be done in 5 hours. I'm gonna get it done, and I'm gonna go home. Not thinking about anything else. Tomorrow is another day, and I'll start over tomorrow.
One thing that I tell people: you go home. Home is home. That's your time for your family. That's your time for your kids. Your time for your spouse. Enjoy that moment with them because they're here with you now. You don't know what may happen tomorrow. So enjoy that time with them.
Yeah, it sounds like you have a good structure that's working for you, because with all the things stuff that you're doing, if you don't have that, you will not be able to help anybody. How can you help anybody if yourself? It's yeah.
It's the same thing. The hospital that I'm working, it's a very busy hospital. But the thing, you know what? I usually has at least 4 or 5 minutes to spend some time to talk to somebody. How you doing? How's your day? Is everything okay? Just a little word, maybe something to that person. It's not gonna kill me to spend like 2 minutes with somebody. So that's the reason why that, you know what, I usually like, you know what, prioritize my time and do really good time management so that, you know, that I can go and do whatever that I have to do.
Good, 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 good. All right. So my next question for you is like, when I'm working, what are some activities and or interests that you engage in that might keep you from getting burnt out?
I like to go hang out with my friends, you know. I like to just go ahead and do exercise, riding my bicycle with my beautiful daughter, and then, you know, I'd spend some quality time with them, joke with them, play with them. So those are the times that, you know what, I take for myself so that, you know, I don't have to worry about anything that can prevent me from burning out.
That's awesome. It sounds like you really thought about how to really make that balance work for you between the personal, and then when you go home, like you say, you don't bring anything home, it's your family, then that's it until the next day when you go back to work. So it sounds like it's working for you.
Yes,
all right.
It has been working for years.
For years. I say, when you say years, how many years would you say that?
What is it?
When you say years, how many years you're looking at? When you say years, that's been working for you.
Probably like, you know what, remember, before that I opened that clinic, it's something that I've been planning for a good like 2 years. So I've been thinking, I've been doing brainstorming. So I work from like, you know what, 5 days a week. So I only have Saturday and Sundays off. So not only that I'm working full time, go to school, and then brainstorming about like a practice. It's a lot. So we're talking about probably like, you know what, 5 to 6 years.
So you had it like for 5 to 6 years, you had to like finding something that's going to work for you where you're not going to go crazy. You're able to do what you need to do and still maintaining that balance between. So you had to create that for yourself, it sounds like.
The moment that you go crazy, everything go down south.
True. And we can't, like you say, you can't, I want to say, if you don't preach to the person, you're going to practice what you preach, right? You got to like, whatever you're going to preach, you have to practice it, right?
But the thing, you know, a lot of time people come to me and say, you know what, let me tell you something. What did you do? How can you? And I will tell them what I do. If they want to just go ahead and follow through. But the problem is some of the times people like, you know, when you come to time management, they're not really good with time management. You need to know how to use your time effectively. That's the key. Prioritize, know your time management very well, and establish boundary between, like, you know what, your professional work and family.
That's awesome. Yeah. I totally agree. All right, so that's all that question I had for you. Is there any last remarks or comments that you might have for us? Things I've been asked that you want us to know about you and the work that you do in the community?
Yeah, but the thing, one thing that I have to tell you, thank you very much, Cynthia, for everything. Thank you. I think it's like I was saying earlier, it's an honor. And I look forward to get involved more in that. And I look forward to give back by using that. And I will continue to work with you guys. Once again, thank you very much for the opportunity. And it's a pleasure and an honor to be part of the virtual spotlight. Thank you.
Yes. Well, you know what? Thank you so much for coming and talk to us today. Talking to you, I learned so much in terms of like what you're doing for the community, and also to bring, like, you show your soul to the work that you do. When I listen to you talking, I'm like, oh my goodness, there's hope for our community, because you know what I mean. You're so passionate about what you do. You want to help people, and you describe so well how you go about doing that. You put them first, as well as putting yourself and your family first. You're able to find that balance where you can do service others, put them first, always think about them, making sure they get what they need to get. In the same token, making sure you have a life for yourself and your family. That balance is so key. And when you talk about the way you do it and your passion for what you do, show us, oh my goodness, we need more people like you.
Thank you. Thank you very much. Thank you.
Yeah, so thank you for the work that you do. What you say?
Thank you, especially that came from you, though. I really appreciate it.
Oh, you're welcome. Being a mental health person myself, I do work in I know how hard it is to be able to help, Haitian people, to let them know, educate them about mental health and how to take care of themselves. And also for like physical part of it, thinking about like physically how they can take care of themselves. Also, that's another way, the challenge there as well. So there's two challenge, the mental health piece and that, because sometimes they might have an illness and it's hard for them to take care of themselves because they think they're okay. They don't need this, they don't need that. So they do that with that part of it. And you also in the mental health where you got to convince them also that you need to take care of yourself mentally. So you've been challenged, looking at two challenges that you have to face. And so I can totally understand that between from a mental health piece, the challenge that I have to look at as well.
And especially among those adolescents, that's the reason why sometimes when I'm dealing with adolescents, one of the big things, find somebody that the patient, the adolescent get close with, believe it may be the mother or the father, work with them. They listen, let me tell you something. This is what I want you to do. I want them to take that medication every single day at this specific time. I want them to come a month, every week to come that medication. Because some of the time, they're not going to go ahead and do it. They don't want to do it. They have all the objective in life. So if you use that parent or somebody that they're close with to do that treatment with them, I think you may be able to achieve your goal with them, though.
Yeah, that's good. That's good. All right. Thank you so much again for coming and being with us today. So I would say good luck. I think you already have your work mapped out for you. You are very dedicated and you're very determined and you have goals and you know how to go accomplish them. So I'm looking forward to hear more about your clinic and what you're going to be doing for the community, in Florida. So.
Thank you, Dr. Cynthia. Thank you. It's a pleasure again. Once again, thank you very much. Thank you to the entire staff. And it's a pleasure and an honor. Thank you.
Thank you. So the video will be available soon to you, and you'll be able to see it, since this is being recorded. So, all right.
Thank you.
Thank you. All right. Bye-bye.